Good afternoon, Miss. I am Arson Vainam Caban from BSN2 Weidenbach, and today I am going to perform rectal installation. So what is rectal installation? Rectal suppositories are used primarily for their local action, such as laxatives and fecal softeners. Systemic effects are also achieved with rectal suppositories. It is important to ensure the suppository is placed past the internal anal sphincter and against the rectal mucosa. Objectives: to instill directly the medication suppository into the rectal area, to provide means for rectal evaluation, to obtain desired therapeutic effect. Gather equipment, check the medication order against the original physician's order according to agency policies, clarify any inconsistencies, check patient's chart for any allergies. This comparison helps to identify errors that may have occurred when the orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of a medication to be administered. Consider the appropriateness of a medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to patient's disorder, and this can also be used to educate the patient about the medication. Place medication on a tray or move the medication cart outside the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport patient's medication to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevents accidental or deliberate disarrangement of medications. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures that the right patient receives the medication and helps to prevent errors. Good afternoon, sir. Ako galit sa nurse line. Pwede ko ma-check yung mga identification band? Pwede mo state yung name, sir?
Anthony Tejano.
Okay, thank you, sir.
Okay.
7. Explain procedure to the client to gain cooperation and to allay anxiety. Sir, good afternoon. Ako gali liwat sa nurse spine. Bali, karon ma-perform ko si mo rectal installation. Bali, ang rectal installation, ma-insert ko si mo sang suppository. Kung magambal ko nga maginawa ka lang dalam, sir, ha?
Yes, yes.
Okay, thank you. Step 7. Perform hand hygiene and wear gloves to prevent the spread of microorganisms. Assist the patient to his or her left side in a Sims position, drape accordingly to only expose the buttocks. Allows for easy access to anal area. Left side decreases chance of expulsion of the suppository. Proper draping maintains privacy. Sir, pwede ka palisa sa my left side, sir? Thank you. Remove the suppository from its wrapper. Apply lubricant to the rounded end. Lubricate the index finger of your dominant hand. Lubricant reduces friction on administration and increases patient's comfort. Separate the buttocks with your non-dominant hand and instruct the patient to breathe slowly and deeply through the mouth while the suppository is being inserted. Slow, deep breaths help to relax the anal sphincter and reduce discomfort. Using the index finger, insert the suppository round and first along the rectal wall, insert about 3 to 4 inches. Suppository must make contact with the rectal mucosa for absorption to occur. Use toilet tissue to clean any stool or lubricant from around the anus. Release the buttocks. Encourage the patient to remain on his or her side for at least 5 minutes and retain the suppository for the appropriate amount of time for the specific medication. Prevents skin irritation and prevents accidental expulsion of suppository and ensures absorption of medication.
Sir, ari naman ko, sir. Bale, ma-insert ako sa bang, sir, ha? Ginawa lang dalom, sir. Stay ka lang for 5 minutes, sir, ha? Para ma-absorb mo yung ambulong. Okay, sir. Thank you.
Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Assist the patient to a comfortable position. This ensures patient's comfort. Evaluate patient's response to the procedure and medication. The patient needs to be evaluated for any adverse effects from the medication or procedure.
Sir, kamusta? Pwede ka nakabalik, sir, sa, sir, sa normal na, posisyon. Bale, wala ka man, sir, may na-feel na katol or sakit, sir.
Wala.
Sige, noted, sir. Thank you, good, sir.
Thank you.
Evaluation. Patient cooperates with rectal or suppository installation. Desired therapeutic effect is obtained. Experiences no adverse effects including allergy response, systemic effect, or injury.